Hi, welcome to Ready to Heal. I'm your host, Betsy Sawyer Galen, and today we are going to talk about modalities of healing, some you've heard of before and some you've never heard of. Today I am going to talk with my guest, Perry Lavenson, and we're going to talk about acupuncture. That's something that you've probably come across. Perry, tell us a little about yourself and how you got started with acupuncture.
Okay. My journey kind of as a healer, acupuncturist, massage therapist started as a kid. I used to work on my mother's feet when she was had asthma attacks and had trouble breathing, and just found that it helped, and that was an intuitive thing. Just I would rub her feet and she'd feel better. Never really thought of anything of it. I gave a friend of mine a massage about 25 years ago, and in the middle of it, she said, "You should do this for a living." Oh, really? People do this for a living? And I found a school and I started to study because it called to me. And when I was in school, I went to a school that was called the New Center for Holistic Health Education and Research in Long Island. And the school specialized in Asian massage. And so I learned a lot about Asian medicine at that time, and I thought this makes so much sense to me, this medicine. So I became a massage therapist. I worked in a physician's office doing medical massage. I had a private practice doing research.
Medical massage would be like shiatsu? Or?
No, medical massage would be deep tissue massage, a lot of stretching, and based on what the doctor felt was necessary for the patient. So I would see the doctor first in the office, and then we had 2 acupuncturists on staff and a physical therapy gym and 2 massage therapists, and the doctor was a physiatrist. And so he would see the patient, and then we would all talk about the best kind of what we could each offer in that situation. It was a great place to learn and practice. And then, so I would see patients. Medical massage was really, I would do maybe 10 or 15 minutes in the area that was of concern. So that's what I did. And then some acupressure at that point. In my private practice, I was doing deep tissue massage and a lot of amma therapy, which is the technique I learned. It's Korean-based massage therapy based on Asian medicine principles.
And then how did you segue to the acupuncture?
I just, as I say, I was so drawn to the medicine as a holistic and preventative system of medicine for years. But I felt, that voice in your head that says, you just finished school. Go do what you just trained in. You don't have to learn the next thing yet, My wife jokes that I waited till we had kids and the price of the education doubled, and then I went back to school, got my degree. What really happened was the doctor I was working for, the insurance rules were changing. And he said that they were not covering the services that I was offering anymore. So he said, if you want to go back to school and become a physical therapist, then I could use you. And physical therapy is a wonderful profession, but that's not what called to me. If I'm going back to school, then I'm going to be an acupuncturist and an herbalist. I mean, I think I really went back to school to learn herbology. Because I love herbology. It's so intricate. And even if you look at the history of Chinese medicine, acupuncturists are kind of looked at more like technicians. You can learn points and you can learn the theory, but the herbalists are more physicians.
And now usually those two go together, the herbalists and the
most people will either take an acupuncture degree and then add some time studying herbal medicine, or the program I went through offered them both at the same time. And the program I subsequently taught in offers them both. You can take them both together, or you can break it out and take them separately. But it's a lot of work. It's medical school.
I know when we were talking earlier, we were talking about different schools of acupuncture, and you were telling me something about traditional acupuncture and classical.
Yeah. So I think one thing that people are really, we have heard the term traditional Chinese medicine, TCM, has been around for a while now. Uh, and it's interesting because traditional Chinese medicine was a coined term during the Mao government in China in the 1950s. And it was their term for what they were going to bring to the world as, China's gift is this system of healing that's thousands of years old. But in line with the communist thinking and the idea of a new modern China, a lot of the aspects of the medicine that address the spirit were taken out, and it became a very kind of, you do this for this, you do this for this, very prescriptive medicine. So in recent years, there's been a push to more of a classical education in Chinese medicine, which is going back to the, source text of 4,500 years ago, 2,000 years ago, and trying to get an understanding of the relationship that those people had with nature and how we viewed our body as part of nature. We really don't have that view anymore. But also, this point it's good for your arm, but there's also the lung houses the corporeal soul, right? So if there's issues with the body or the manifestation of the body or strength, then that might be a good point to strengthen that soul, right? The liver houses our ethereal soul, the soul that kind of moves on after we die, right? And so if there are issues of dissatisfaction and the soul searching, right, there are points perhaps on the liver channel in support of the liver function of housing the soul, giving the soul a more comfortable place to live, and thereby helping it find its way more easily.
Let me ask you a question. If somebody suggests to say I suggest to a friend you should go to an acupuncturist, is it important what type of acupuncturist they go to? Is that something, a distinction that anybody should feel concerned about, or should they just go ahead and try it?
My feeling is people end up where they're supposed to be.
So just go with the
Truly.
person who's recommended to you?
Yeah, I would. And then if it's not working, talk to them about it. Don't be afraid to say, I'm not getting the results I want. Would you be offended if I tried someone else? I said, the majority of practitioners understand that what we're doing is energy. It's energetic exchange. And,
right.
And so all the points could be right and the theory could be right, but the energy's not right. And maybe another practitioner will have a better fit with that particular person.
Yeah.
So, but there are a lot of different schools that we were talking about, approaches or philosophies or schools of thought around acupuncture that focus really on the channels and keeping the channels in balance. So that's called channel theory. And there's point theory, so just writing point prescriptions. There's 5-element acupuncture, and each of the organs is associated with an element. And then it's also associated with a season and an emotion, right? And a spirit, one of the 5 spirits that live in our body that make us who we are. And so 5-element acupuncture really focuses on bringing those things into balance. It's more of a philosophical and spiritual approach.
Let's talk about some of the things that people commonly would go to an acupuncturist for. There are certain types of issues that seem to lend themselves to acupuncture. Can you tell me some of those?
Sure. I mean, people think of acupuncture, I think, first off for pain. That seems to be the number one thing that people think, oh, my back's acting up. I'll go to an acupuncturist. Or I see a lot of tennis elbow this time of year, back pain, knee pain, those kind of ailments. More and more, we're starting to see people show up for asthma, allergies this time of year. I have my practice for the last 12 years has been focused on fertility, male-female fertility, and women's health. That's not something people often think of.
Right. I wanted to talk to you more about that because I think that's an issue that a lot of people don't know where to turn, and they don't think of an acupuncturist.
Right.
So tell me how you started treating that particular issue.
I was in school and I connected very strongly with one of my professors. We just got along very well. We were very simpatico in our understanding and philosophies. And it was her specialty and her practice. And at some point, I said to her, "You need me to work for you as your assistant." And she said, "I don't think I need an assistant." I said, "You do." And I made myself invaluable. I like to think. Kind of, because I was already a licensed massage therapist, I was able to do some massage for our clients. And because she had a very busy practice, as people would leave, I would make sure the room was turned over, clean the table, set up the table for the next person, bring people in and out, get tea for people, just whatever they needed, whatever she needed done. Get her lunch if she needed. I was really threw myself in. But as a result, I really got to study closely with someone who was an expert in the field and taught me a lot. Jill Blakeway is her name, and she has written several books on Chinese medicine and fertility. One is called Making Babies. And another one I think is just about to come out, but she's a brilliant practitioner, and I learned a lot.
Oh.
Really grateful for that opportunity.
And so now how many treatments would a person think that they might need? How do you determine how many treatments a person needs?
Well, it differs from person to person. In a fertility setting, a lot of what we see is irregular menstrual cycles. If we can regulate the cycle, someone should be able to get pregnant, right? If there's no blockage, if there's no physical obstruction. So sometimes there are blocked fallopian tubes, sometimes there's damage or scarring in the tubes. That makes it more difficult. But all things being equal, there are a lot of people I see who come to me from their reproductive endocrinologist with a diagnosis of idiopathic infertility or infertility for no known cause. Right?
Mm-hmm.
The feeling is that if the body's out of balance, it's not going to do what it's supposed to do. Right? So a body in balance should be able to get pregnant and carry a baby. So then my job becomes to figure out what the imbalance is. So the general length of treatment is at least 3 months, just to get the cycle regulated and to get things where we need them to be. I've had cases. I had a woman came to me. She was 28 and told that she wasn't going to be able to give to conceive naturally, and she was not going to be able to even have her own eggs. They called it premature ovarian failure, and arranged for her to have a donor who was going to go through the stimulation and produce follicles and donate her eggs, which were then going to be inseminated by this woman's husband, his sperm, and then they'd be put in her womb to grow. And she came to me to prepare to get herself ready for the donor cycle. So she wasn't even trying to get ready. I mean, she wasn't trying to produce follicles, or she just wanted to kind of be calm and increase blood flow to the uterus so she had a good uterine lining. And during the 3 months that she was seeing me, I had her on an herbal formula as well as acupuncture once, sometimes twice a week. She got pregnant naturally.
Wow.
So she never actually had
She never had to go through the donor egg.
Cycle. Right.
Oh, that must have been wonderful for her.
Yes, wonderful for her. And, all the reproductive endocrinologists I work with are really happy when people get pregnant. I mean, it's what they want.
Right.
So it's kind of good for everybody. And sperm count is the same thing. It's interesting. It takes about 90 days, right, for sperm to mature and grow. So the sperm that are going to be used to inseminate an egg in 3 months is what is kind of being developed now, right? So we need to spend time over that 3 months to kind of nourish that area of the body that develops the sperm. The same is true of the egg, right? The egg starts to mature. There's and it's all attrition, right? A bunch of eggs kind of say, okay, this is our turn this month, and they're going to go. And then over the course of 90 days, it gets wheeled down until there's one. The primary follicle becomes ovulated, and that becomes the candidate for insemination, right? But it's still a 90-day process in women. And so with men, we're constantly making sperm. With women, you're born with your full complement of eggs. So it's harder to affect the quality. But if we, use the right medicinal substances and foster an attitude of self-nurturing, it becomes easier.
Oh, very interesting. I wanted to ask
I
you
could go
too.
on for hours.
I wanted to ask you too. Are there other cultures we know? For example, China is very receptive. Obviously, this came from China.
Mm-hmm.
Are there other cultures that are more receptive to acupuncture than
There,
we are? We're moving in that direction.
you know, I think about the United States, and I hope I don't offend anybody. But I think it's pretty easy to see that in a lot of ways we are still only, 250 years or 300 years from a very puritanical beginning, right? So these ideas that don't make sense to the Western mind are a little bit like, what is that? And it takes a little more time
Uh-huh.
to, a lot of countries in Europe have embraced Asian medicine. There's a big Asian medicine practices, throughout Russia. France is another country that has a lot of acupuncture and a lot of innovations and different ways of thinking about acupuncture. A lot of our modern scholars and writers in the field of acupuncture have come out of Germany.
Oh.
Right, so it goes from Chinese to Germany to English. So really learn. One of the things that I say is on my bucket list is I'm going to learn to read Chinese so that I can actually go read the classics and form my own opinions and not read someone else's opinions
Uh-huh.
about what that is.
That makes sense. That makes
Still
sense.
working on it.
Yeah.
It's a job.
I wanted to ask you also about if you. I know you were speaking about the fertility issues. Are there other patients that you've had that stand out in your mind that have had like a dramatic recovery from acupuncture?
Well, it's funny. I had a patient who was complaining of tooth pain, and so he's like, "It's killing me." And the stomach channel enters the lower gums, and the large intestine channel enters the upper gums. I didn't get that backwards, but he was complaining of a toothache, and I said, "Well, we're working on your neck and your back, but I'll stick a couple of needles in the distal channels of those points, different points in those channels, just to kind of see if we can draw some of that out." I said, "But you have to promise me that if the pain goes away, you're going to go see the dentist anyway, because you don't want to mess around. But if we clear some heat and we if there's an infection there, you have to know." And he said, "Okay, I promise." He got off the table half an hour later and he said, "I can't believe it. My tooth doesn't hurt." And I said, "I believe it." What people always say when I first started, I was always like, "I can't believe this works," and now you're
Right.
amazed when it kind of doesn't work.
Right.
It's the same thing. But so I said, "Okay, go to the dentist." And then I saw him a few weeks later and I said, "Do you go to the dentist?" He said, "Why? It doesn't hurt anymore." I said, "Oh, see, we had a deal." And then I saw him. I hadn't seen him for a while. His neck was improved and he'd gone on with his life. And I ran into him at the supermarket. And he goes, "My tooth has never hurt me again."
Wow.
And I said,
Wow.
I'm not promising. I can't promise those results for everybody who walks in, but
We only have another moment, but
yeah.
I just want to ask you quickly: what should a person expect to pay for an acupuncture session?
It varies wildly. I know people who charge $400 for a visit.
Wow.
Who do pretty much what I do. Do you know?
Yeah.
So I would say you're looking an initial visit, anywhere from $100 to $150, maybe $175, depending on where you are. I know sometimes it's more than that. In Manhattan, people will pay $200, $225. And then follow visits range anywhere, again, from about $80 to $100, $120. And I think my fee structure is kind of right in the middle. The initial consultation is $130. It's about 70 to 90 minutes and includes a full Asian medical assessment. And that's one thing we didn't talk about, but the assessment is looking at the tongue, which is kind of a mirror of the body, taking 9 pulses on each wrist, which talks about how your body is working, your qi and your blood. Qi is kind of the body's energy, for want of a better word.
Right.
How it's moving through the body, how your organs are contributing to that. Each pulse on the wrist relates to a different organ, so you really get a sense of where things are moving and not moving.
Uh-huh.
And then, of course, a full review of your body systems, right? How are you sleeping? How are you eating? Are you pooping? Are you thirsty? Do you get hungry? That whole thing. And how are you sleeping? All of that gets taken in. And so 75 to 90 minutes is a pretty standard.
Okay. Wonderful.
You know.
Thank you again for being my guest. This is Perry
Thank you.
Lavenson, and I'm Betsy Sawyer Galen, and thank you for joining us. See you next time on Ready to Heal. Hi, okay. I'm with my guest Perry Levinson, and he is going to do a demonstration of acupuncture now, and I will be the guinea pig.
This is really just demonstration purposes. In a regular full acupuncture session, ideally your acupuncturist will have performed a complete Asian medical assessment, and the point prescription, the points that they're going to use, will be based on what the findings were from that assessment. But today, I just want to give you a look at kind of what the needles look like, what they look like when they come out of the package, what they look like when they go in the body. Also, before we begin, right, we wash our hands. I don't have a sink, so I'm using just an alcohol prep swab, just to make sure that my hands are clean. This is an important part of the demo because you want to make sure your acupuncturist is washing their hands. Okay. The needles we use are all single use. So we open the package, we use them, and then we throw them away into a sharps container. Okay. So I picked 3 specific points so that I can show you kind of 3 different size needles and needles that we use. So you'll see that I clean the point with alcohol. Right? Again, that helps to fight infection or the risk of infection. So the first needle we're going to use is kind of the baby bear, right? And you'll be able to see that it is just, I don't know if you can see it even, it's tiny, right? It's a 1/2 inch long, and it's a 34 gauge needle. So the higher the gauge, the smaller the diameter of the needle. So the needles you get an injection with are about an 18 gauge. So these are twice as small, right? Just about 34 gauge. Ready?
Mm-hmm.
Okay. There we go.
And I can say it really doesn't feel like much when you put it in. You can feel a little something, but hardly anything.
Sometimes you'll feel a little pinch, sometimes you'll feel a little ache. But really, there shouldn't be any real sharp, lasting pain. And what happens is people often experience that the sensation of achiness may come and go through the course of a session. So needles can be retained or left in for anywhere from 20 to 40 minutes. And you see what I'm using here, this needle's a little longer because that's what the point requires, but it's still just as thin. So here it is. There we go. Yeah. Right. So I'm using a guide tube, if you can see that right here. Right. What that does is it presses on the skin, and it gets all of our pain receptors, or our nerve endings that receive pain, are on the surface of our skin. That's how we know if we touch something hot or if something hurts, we move our hand. So by using the tube, what we do is we tighten the area of skin, and we're able to get the needle through the skin faster, and then there's less pain.
Oh.
Right. So practitioners use both. Some people will use a tube, and some people will do what they call freehand needling, no tube. So this insertion up here was freehand, and you saw me tap it in with a tube, and on this needle here. And then here I'll do another freehand needle just so you can see the difference. So here I'll hold the needle up on the handle, right? And I just kind of rub the point to get it ready, and then I'll just stick the needle right in. And that wasn't too bad.
Not at all.
Yeah.
I was just going to ask, what are these points for? What do these correspond to?
So this point is called an extra point. There are 400 points on the body. And this point is one of the miscellaneous points. It's called yin tong. And one of the things it's really good for is relaxation. I use it also in combination with kind of getting people in touch with their own intuition, because it's also the third eye.
Mm-hmm.
So you can kind of combine philosophies a little bit.
Uh-huh.
Yeah, but in Chinese medical perspective, it's really oftentimes as soon as that needle goes in, people just relax. They'll close their eyes, and if someone's nervous about needles, that might be a point I do first because it helps them relax and
Relax.
calm down.
That makes
Yeah.
sense.
And then once the needles are in, as I say, they're in for anywhere from 20 to 40 minutes. I saw a gentleman this morning with a bad back, and I actually had him face up and did some points that are good for moving qi and blood in his body. And then I took those needles out and turned him over and did points on his back for about 20 minutes.
Oh.
Right. And throughout the course of the treatment, the acupuncturist may turn the needle. So just come in here, right? So it's just this little movement, just turning the needle like that. They may move it up and down a little bit, right? Sometimes even you'll flick the end of the needle, right? That's an older technique. It's called calling the qi, right?
And what is that? That's just...
It's a way to stimulate the channel. Mm-hmm. Yeah, and the twirling of the needle does a couple of things, right? We, from a perspective of classical Chinese medicine, right? Moving the needle like that, we can actually, if we move kind of towards the midline of the body, we're actually bringing energy in or reinforcing something that's weak. If we turn it the other way, we can draw out something that doesn't need to be there, something that's excess.
Oh,
right?
Interesting.
From a Western perspective, we have connective tissue runs through our body. Our connective tissue is the same structure almost as a quartz crystal. And a quartz crystal, naturally occurring crystals conform to a law of piezoelectricity. And what that means is pressure electric. So if you put pressure on a quartz crystal, it will create a small electric charge.
Oh.
Right? So what we're doing here is by turning the needle, we're actually stretching the connective tissue and creating these small electric charges that can then travel.
Oh, interesting.
Through the body.
Oh,
so it's one of the mechanisms of action, or supposed mechanisms of action of acupuncture from a Western perspective. Stimulating these points. What's cool about that is once the needle's in, all of these little areas are kind of stuck in place. The connective tissue is pinned down, right? And Norm Shealy, who's a wonderful physician who started the American Holistic Medical Association, wonderful, beautiful human being, but he said once these needles are in place, then every heartbeat will cause a stimulation because it slightly puts stress into the system around the needle.
Oh,
so
interesting.
Every heartbeat creates another charge that helps, direct the healing where it needs to go.
Oh, cool.
Yeah, I think it's cool. Right. So these points specifically, yin tang is for relaxation. Right. This point is as a point on the lung channel, often used for excess in the lung, excess accumulation of phlegm and fluids, pain in the lung area, difficulty breathing. And this point is a point on the large intestine channel. And this is also the point that everyone says, oh, you have a headache? I know the headache point, right?
Oh, right.
Because the channel runs up into the head, the large intestine channel.
Oh.
So this point's great for toothaches, for nasal congestion, for headaches. It's also really good because it helps to move qi in the whole body, so it's good for constipation, right? It's interesting that points on the large intestine channel generally don't treat the large intestine. They treat the channel, right? So arm pain, shoulder pain, congestion, toothache, right? Except for this point, which will treat constipation.
Oh, that's interesting.
Yeah.
So it's all going up, basically.
This particular, it's the channel is called the Yang Ming channel, Yang brightness. So Yang is the active part of the body. And so the Yang Ming energy is very full and moving. And so it comes up into the forehead and into the face. And so that's why when you have a cold, when you catch a cold, we say that it starts out as a wind cold or a wind heat. Wind and cold enter the body. And you end up with congestion or a clear runny nose when you have a cold. If you have wind heat, it's more dry congestion. The heat dries things. And the cold makes things run and clear. So there's a distinction between colds in Chinese medicine too.
Oh, interesting.
Right. So wind and heat or wind and cold. But oftentimes the pathogens enter the body, cold enters the body, and then as things get gummed up and don't move as freely, it turns to heat. Right? And so then you start having heat signs. And one of the first places that the heat can affect is the Yang Ming channel. So that's why you kind of, oh, I don't feel so well. I'm kind of achy. Maybe I have a scratchy throat. And then 2 days later, you have a fever and your cheeks are red and your throat is dry, or all that heat all of a sudden. Right? The cold transforms to heat, and that's in the Yang Ming channel. Right? So we use these points on this Yang Ming channel a lot for cold and stuffiness and like that.
Interesting.
Okay, I'm going to take these needles out.
Okay. All right.
And again, just, right? And so sometimes there's a little drop of blood, or, the risks of acupuncture include a little bleeding, sometimes, not all the time, a little bruising because we are puncturing the skin. There is a risk of infection because we're puncturing the skin, but again, we're very careful. We clean our hands, we clean the skin. We use single-use disposable needles. And there's also a minor risk of organ puncture, which people should know about if they're going to see an acupuncturist. Right? Especially one of the biggest targets, or it's not really a target, but one of the biggest areas that we have trouble is in the lung. People needle because there are points all through the chest. And if you needle too deeply, if you needle at an incorrect angle, you can puncture the lung, and then that causes
I
a
never
problem.
heard of that. That's interesting.
That is, that's a risk. It doesn't happen often. I've been in the field for 20 years, and I've seen it twice. One time was someone who just was not paying great attention, and one time was a student who was learning. And my experience has been that the connective tissue around the organs is really thick. So if you're going to stick a needle in the lung, you really have to work at it.
Yeah.
Do you know what I mean?
I would think so.
And so sometimes people make that error, but it's very rare. But I don't want to scare anyone away. Acupuncture is a wonderful therapy. But going into the therapy, you need to be fully informed as to, what the risks are. And that's one of them, although minor.
Okay. Thank you.
Thank you.